Check Podcasts. Hi, I'm Bruce Williams. I'm the CEO of the Greater Victoria Chamber of Commerce. Welcome to Chamber Chats, which, as always, we are recording here in the podcasting studios of Czech Television, one of our chamber champions. I will begin, as always, by acknowledging that I live and work in the unceded ancestral territory of the Lekwungen-speaking nations, the Songhees and the Esquimalt. And Chamber Chats is made possible by the support of Island Savings, a division of First West Credit Union. Okay, so all the way through the pandemic, all the way through COVID, we've been hearing over and over and over again about frontline healthcare providers, the doctors, the nurses, the hospital people, the 911 people. There are other frontline healthcare providers who have been in your life before the pandemic, certainly all through it, and will be there after. And they are the people at your local pharmacy. We're going to talk about the role that pharmacies have played in all of our healthcare through this pandemic and beyond. Joining me to do that, Linda Gutenberg is a pharmacy manager with Hart Pharmacy, a chain of 6 pharmacies across the region. Linda is also, by the way, on the board of the BC Pharmacy Association. And Murray Byers is the pharmacist and owner of the Royal Oak Shoppers Drug Mart. Thank you both for being here today. You bet. I want to go right back to the very beginning. And Linda, I'll start with you. In the first sort of few days of this all percolating and the pandemic being declared, what sort of pandemic panic set in the stores, and what sort of measures did you have to make right away?
Yeah. So one of the first things that we always see when there's, a lot of uncertainty and panic amongst the public is people trying to stockpile their medications. So one of the first things that we had to deal with was, trying to maintain that flow of medications and making sure that people weren't trying to, build up their own supply beyond what they needed. And so we had a policy that was, reinforced by our college and association of limiting supplies to 30 days supply, just until we kind of assessed as to whether there was going to be a huge impact to the supply chain for medications.
Yeah, stockpiling medications and toilet paper, too. We're going to come back to that in just a minute, too. But Murray Byers, you're a part of the Shoppers Drug Mart chain across Canada. So there will have been stuff that was put in place by that corporation that you guys were adhered to, correct?
Yeah, that's right. Again, early on, as Linda indicated, the biggest thing was the stockpiling of medication. We saw that was March 10th, that weekend. I remember we saw that month, or the 6 weeks after that, we saw a 30% increase in our script count.
Wow.
People getting stuff, and just from the uncertainty of it all, that was the biggest thing. In those early days, every day the information changed, masks, no masks. I mean, putting up barriers, those things came, as time and as the information, changed, and we were able to implement. And, certainly we did everything locally that we could, but nationally, we've got people that are looking at these from a national perspective and gave us guidance and support that way as well.
Linda, I have to think, too, that as we all sort of settled into what this was going to be or not be, or all the uncertainty, that sort of uncertainty, and even, I don't want to use panic, but it must have been pretty palpable across the counter from people coming into the Hart pharmacies.
Oh, absolutely. Absolutely. And people were, asking us for things that were, not even their own, medications that they were on and worried about they were going to run out of them, but they wanted antibiotics and they wanted just anything that they thought they might need. And so just, a lot of time was spent by the pharmacists and the pharmacy staff, just kind of calming people down. And, to make matters a little bit more even difficult for the staff in the stores, is we were getting our information, from the same place that everybody else was, by watching the updates. And, we weren't getting any advance notice of changes in policy or anything. So it was all very reactive and, very much a sense of nobody could really count on the information they were getting, because they knew it was probably going to change the next day or within a week for sure.
Yeah. So Murray, you and your staff, no directive from any health organizations, health ministries, federal government, nothing. You were just kind of working through it.
Nothing specifically. Again, just like we all were listening to Bonnie Henry every night to see what was going to happen the next day. And again, the information changed so quickly. that was the biggest challenge. I don't know that we've ever seen, or at least I've never experienced that in a practice where changes came so quickly. And then even within our regulatory bodies, the college and even the PC Association responded very quickly. And things we've been trying to change for years, all of a sudden, within weeks, we're getting updates and changes and support again from our regulatory bodies, which we needed just to maintain care. Because all we were trying to do is just maintain continuity of care, making sure there was no gaps. And that was the early days. And just another comment just regarding in our own staff as well. I mean, we were dealing with a pandemic as well. We weren't immune to it. And so managing the expectations of my staff and our staff, that was a challenge as well, because things were changing. They didn't know, should I be coming to work, not coming to work? There was a lot of hesitancy within the staff too. So we had to, from a business perspective, manage those expectations quite be very accommodating and just being very aware of the staff's needs.
Yeah, I mean, your staff, like all the other ones that Linda mentioned too, you're dealing with people who are in a state of despair in some cases.
For sure.
So your staff, again, that's the front line part of it, right? You're the people on the other
Yeah.
side of, well, eventually the plexiglass, but they're the ones that people went to for some reassurance. And Marie, how can you prepare your staff for that?
Yeah. Well, again, you just give them the best information that's available and touching base with them multiple times throughout the day. I usually touch base with them at least once a day just to say, hey, how's it going? But we had staff members who had clinically vulnerable family members at home, so they're bringing that stress to work and the burden, and they're not sure what to do. And at some point, there were times that I really can't tell you what to do. Just you need to just make your decision, look after your family, and that's what we need to do. And ultimately, that guided us until we got further into it, and we got some more concrete guidance, masking, barriers, the distance, the capacity limits, things like that. That certainly, once those were in place, they gave us a bit more of a criteria to work by, and certainly and to be enforceable as well. Because again, early in the days, we're trying to think what we're doing is safe, but not everybody's on the same page, and that there's some conflict that arose that maybe didn't have to, which again added that stress to the frontline people for sure.
Yeah, we've been saying from the very beginning that the mental health impact of this pandemic will
Yeah.
be greater than the economic impact. So we want to talk about that, but I want to come back to that whole supply chain thing and people hoarding toilet paper and that kind of stuff. We're going to talk about that next. Chamber Chats today, we're talking about frontline healthcare providers in the pharmacy where you go to get the medications you may need. Linda Gutenberg is with us. She is a pharmacy manager with the Hart Pharmacy chain, 6 of those stores. And Murray Byers is the pharmacist owner of the Shoppers Drug Mart at Royal Oak. So Linda, we talked before, you were saying that people came in trying to stock up on things, whether they needed them or not. But talk to me a little bit about getting that stuff in place, that people were hoarding Kleenex and toilet paper and canned goods and all. How did you manage that at the retail level in the stores?
Yeah, so for our chain of stores, I mean, we're mostly very small stores and would never, stock more than a couple of boxes of toilet paper or Kleenex. So, I mean, we were wiped out pretty much instantaneously, and then we were at the kind of mercy of our supplier and whether they could supply it or not. And for the most part, it was not. So we spent the better part of a year without having any toilet paper or Kleenex in our stores, and even had to get creative to be able to have it for our own staff to use in the washrooms. So yeah, that was a bizarre period to go through. So
Yeah, I don't think anybody would have anticipated that, but I'll bet you it's in the manual for the next time around, should this ever happen again, to be prepared for that. And Marie, what
yeah.
about some of the other products? I mean, your stores both sell food products and other
Yep.
retail type support items. How did that all kind of progress through the chain?
Yeah, certainly. Again, in the first few weeks, it was kind of a progression. Again, it seemed like the toiletries, all that type of stuff, the paper goods, they were the first to go. And then probably 6 weeks, 8 weeks into it, then the OTC products, the Tylenols, cough syrups, lozenges, antihistamines, things like that. And I can tell you, I took a picture of it, and I have I have 24 feet on two sides of an aisle of these products. And I had maybe, if I put it together, 4 feet of product. Like it was unbelievable the volumes that people were buying. And again, it's stuff that they may have used, but maybe not. But it was that panic sense. And that really kind of surprised me.
Yeah.
And then as far as restocking, I mean, it was probably, that was kind of May, June, July. We were September, October till we got OTC stuff back, into at least a reasonable supply.
Yeah. OTC is over the counter, by the way, not by
Over the
prescription.
counter,
But yeah. So I don't know if there's a right answer for this or not, but did either of you see, and Linda, I'll start with you first, did you see an increase in people getting prescriptions for anxiety and panic? And did that stuff start to go up?
Not a lot at the beginning. I mean, we definitely saw people who had anxiety disorders and who would have medications that were only used kind of as needed. We definitely saw them needing to use those type of medications that were used only sparingly, definitely needing to use those more. I think that, the increase in the mental health effect, in terms of people who wouldn't have been receiving prescriptions for those type of conditions and then needing them down the road. I think that was really, a little bit delayed. Part of that is, of course, the access to doctors and, family practice and primary practitioners in Victoria is abysmal. So, a lot of people couldn't really get into it and didn't really feel comfortable going to a walk-in clinic and talking to a doctor they'd never met before about how they were feeling. So, I think it was more with people who already had a diagnosed anxiety disorder, just really decompensating and needing more medication or higher doses than they had before.
Yeah. And then, Murray, to go back to that sort of frontline role that you and your staff play, were you getting more inquiries from people about, I need something to help me sleep. I need something to help me control my anxiety. I don't have a prescription. What should I do?
Yeah, certainly that was the anxiety component, the sleeplessness, the insomnias. They certainly, again, kind of 3, 4 months down after it kind of started, we did see a spike in that, a lot more queries that way. And to Linda's point, the access was very limited. I'm not sure that we were quite into the telehealth things yet. And again, to their point that, talking to someone over the phone about this it's a tough discussion. If you're not comfortable having that talk in the first place. So we certainly did see, again, coming to, again, the frontline pharmacists that, what can we do? And, yeah, and it's a tough discussion because we're accessible, but we don't have quite the scope that maybe we should have. So
Yeah.
that's
I mean,
for a
you,
later discussion.
yeah, and you both talk about that increase in consultation that people want. That takes more time than normal.
For
You've got
sure.
orders backing up. That takes more time than what would normally happen. So, Linda, was there an adjustment in hours based on the burnout factor of staff and even the number of staff available? Did that adjustment happen?
So, not for us, no. I mean, most of our stores are not open late. And so, in fact, we actually added an hour earlier in the morning to one of our stores, just to kind of spread out the availability of when the customers could come, so that we could try to keep the numbers down in the stores. So we actually ended up opening a little bit earlier in some cases than we had been, opening at 8 instead of 9 in the morning. So.
Marie, did you have to make any adjustments with staffing and people's availability?
Yeah, not right away. I think it was probably once we got to the fall time, September, October of that year. Uh, what what it was kind of a perfect storm. I started losing staff
Right.
because of the great, I can't do this anymore. I need to do something else, other opportunities. So it was a combination of that and then the increased workload. So I believe in that fall, we decreased. We were 8 to 10 weekdays. We went to an 8 to 8, just a 12-hour shift. Then we lessened our hours a little bit on the weekend. And again, it was just to give our staff a break. it compressed our workload, and so we accepted that. But I think just to be home earlier and less hours, that did help us a little bit. And then we came back up in the spring. We got back to full-time hours. But then again, August of last year, I've been at reduced hours since August. So about a full year now, I've been at reduced hours.
Here's just kind of a random question. As this moved along and people were staying and working from home more and more often, did you start selling less personal care products? Did people buy less soap and shampoo and that kind of stuff? Linda, did you see any change in that?
We did, even though like most of our stores don't have a huge health and beauty aids section, but definitely the stores that have a full line saw a much reduced sale of things like deodorant and shampoo and certainly the more like higher end soaps and bath products definitely saw a huge reduction in those.
Yeah, Maria, I have to think cosmetic sales were down.
Yeah, there was a decline, definitely. I mean, we were wearing masks the whole time, so there was
Yeah.
no need for all the makeup and lipsticks and stuff like that. And yeah, so certainly it did impact sales for sure.
So, of course, two of the most popular words that have been used throughout the pandemic are home delivery. We want to talk about that next. We're talking about frontline healthcare providers in your local pharmacy today on Chamber Chats with Linda Gutenberg, who is a pharmacy manager with Hart Pharmacy, and Murray Byers is the pharmacist owner of the Shoppers Drug Mart at Royal Oak. So both of you in your outlets have post offices. And if I'm not mistaken, I believe Canada Post has become the largest courier service in Canada throughout all of this. So Murray, I'll start with you on this. As people didn't want to leave home, they wanted stuff delivered to them through whatever services you could provide them with, or Canada Post. How much did that stuff increase for you with home delivery?
Yeah, so my post office was just 2 years old, so it started. So I don't have a lot of history on that, but I know again last fall, our first Christmas, kind of December, was very heavy. But last year, our second Christmas was started November 1st, and it seemed to just carry on, and certainly the volumes were very high. And again, with the capacity limits, we had people waiting outside the store just to use the post office.
Wow.
We had a lineup specifically for that. So as far as percent, I'd say we saw maybe 20% lift, like overall. But again, I'm a newer post office, so I didn't have a lot of history. So I was hoping that's just normal business gain, but it was definitely an impact, again, the staffing and what we needed to do as far as managing that expectation.
Yeah, Linda, you must have seen a lift in the use of the post offices.
We did. Two of our locations have post offices, and it was a huge challenge, not only with the increase in people wanting to use the post office or there to pick up packages that they had ordered, but also just in managing the traffic flow because of our store size and our COVID number inside the store was so small. We would have to split that between post office and the rest of the store. And so often we were only able to let 2 or 3 people in the store that were there to use the post office.
So, Linda, you would have had delivery in place before the pandemic, though people always were having prescriptions and things delivered to their house. How did you deal with that increase? Did you find other people to do delivery for you?
Yeah, our stores have always had delivery service, as you mentioned, but our volume of things increased, probably tripled
Mm.
during the pandemic, and has stayed high to this day, such to the point where in the past we would have only had one delivery go out each day from each store. And to the point now where we would have 3 delivery times, 3 deliveries leaving the store each day. And deliveries often, because of the volume, the delivery people are working until 7 or 8 o'clock at night, even though the store they picked up from closed at 5:30 or 6.
Marie, how did that impact you? How did you manage deliveries?
Yeah, similarly, we've always had, again, prescription delivery, but we also saw now people ordering toiletries, home items, health and beauty aids, soaps and shampoos and things like that along with it, which again, we weren't prepared for. I didn't have the staffing to deal with. So we've had to kind of change that and adapt to that. And again, as Linda indicated, it's sort of just continued. It hasn't died down. People kind of got used to it, and they're utilizing it, and it's become a big part of our sales now for sure.
So it's probably fair to say that people are used to it, so it's not going to go away, Murray. That's going to continue.
Yep, I would expect it will. Yeah.
Linda, I want to ask you about administering vaccinations. You at Hart Pharmacy have done that for people who travel, for example, in the past, international travel where vaccinations and things are necessary. So now you're in the COVID vaccination business. Tell me about getting that ramped up and what's going to happen with the next round of vaccinations.
Yeah, it's been a lot of change for sure. We were a part of the AstraZeneca vaccine as soon as that rolled out for the pharmacies, and just trying to use as much pharmacist coverage as we could to do as many vaccines as possible. The kind of good news, bad news was everything was booked through the BC immunization system. So, it was all appointment based, which is good when you're trying to manage staffing and stuff and have dedicated staff for doing vaccinations. But also a whole nother technology that all the pharmacists and a certain number of assistants had to learn to be able to provide that service. And getting the vaccine in and trying to utilize it as quickly as possible was a huge challenge with trying to manage your staffing and be able to do as much as we could, but with the limited supply of staff that we had.
Yeah, I think Murray, in one of the exchanges we had on email, you were available at one of the times to record this because you were on vaccination duty. You were doing COVID.
Right. Yeah, that's right. Yeah, and the same thing. We were started with the kind of AstraZeneca kind of introduced us to the COVID vaccines. We got some learnings out of that, and then the immunization software came through provincially, which was really a great technology. It helped centralize that, and again, appointment based. It helped us organize it a lot better. I mean, literally before that, we were just had a spreadsheet on a computer that we were just putting people's names in and had a month's worth there, and that's the way we went. So it's certainly that's been a great asset for us. And again, moving forward for the fall, that's going to be a good asset for us.
Well, we've had this conversation today, this chamber chat, because we did want to acknowledge the work that pharmacies have all done as frontline healthcare providers, and you soothed a lot of souls. You took care of a lot of people. We're not quite through this quite yet, but a lot of things have changed. So we just did want to acknowledge you and others in your sector who have done what you do. So thank you very much for being here. We should do another one of these. There's some other stuff we need to talk about. Linda Gutenberg is a pharmacy manager with the Hart Pharmacy chain, and Murray Byers is the pharmacist and owner of the Shoppers Drug Mart in Royal Oak. Thank you to both of you again, and thanks for being with us.